So welcome all. Today this is me, Vidhya Lakshmi P.N, working as a nursing lecturer in ES College of Nursing. So today's topic is about Congenital Talipus Equinovarus. So from the word, the Congenital Talipus Equinovarus, the congenital means the disease or any condition which acquire from the birth, that is known as congenital. Talipus here symbolizes ankle, and equinovarus, it's a deformity related to ankle. So here this deformity related to ankle means either it can be inverted or outward, or sometimes it can be plantar flexion or dorsiflexion. So we will see in detail about Congenital Talipus Equinovarus. So Congenital Talipus Equinovarus is otherwise known as clubfoot. So malformations that occur during the prenatal period and are present at birth are termed as congenital anomalies. So many times these can be corrected during the first month of years of life. So when a baby is born, as a pediatric nurses, we used to perform essential newborn care as well as the immediate newborn care. So when we are assessing the APGAR score, at that time itself we can identify any deformities is there or not, and that too the deformities related to skeletal system, it is very much evident when a baby is born. And sometimes certain congenital deformities related to heart or lung, it can be detected only when a baby exhibit any signs and symptoms. So whereas the babies with clubfoot, we can evidently see by a inspection itself baby is having any deformity related to skeletal system. So skeletal system defects which are very evident, and we can immediately start the treatment as soon as the baby is born. So some skeletal system defects may not be evident until later in child's life. So that means when a baby is born, so after the baby achieves a delayed milestone, then only we'll come to know the baby is having certain deformities. So in that condition, the Congenital Talipus Equinovarus is otherwise known as clubfoot. It is usually it is evident at birth itself. So we'll see about the Congenital Talipus Equinovarus in detail. So congenital clubfoot is a deformity in which the entire foot is inverted. The heel is drawn up and the forefoot is adducted. The Latin talus meaning ankle, so meaning foot, so make up the word talipus, which is used in connection with many foot deformities. So when we are considering about any foot deformities, we will spell or pronounce the word with talus. So talipus or talus means ankle. So here in Congenital Talipus Equinovarus, either it can be inverted or outward, and sometimes it can be dorsiflexion, or sometimes it can be plantar flexion. So club deformity is mainly we can identify with the mnemonic cave, that is C for cavus, that is midfoot is having any abnormality, A is adductus, that is forefoot, V is varus, that is heel, and E is equinus, that is hindfoot. So here, based on the deformity related on the position, whether it is in the forefoot, whether it is in the midfoot, or whether it is in a hindfoot. So in that way, we are going to classify this Congenital Talipus Equinovarus. So next is equinus or a plantar flexion and a varus or inversion. So denotes the kind of foot deformity present in this condition. The equinovarus foot has a club-like appearance, thus the term clubfoot. So you can see in this image, the baby is having clubfoot. So this clubfoot can be identified when a baby is born. When we are giving any immediate newborn care or essential newborn care, we can identify by through inspection itself that baby is having any abnormalities related to skeletal system. So here in this image, the baby's foot is turned inward. So next, I have already explained you this Congenital Talipus Equinovarus, otherwise known as clubfoot, is denoted by a mnemonic cave. So K means C for cavus, A for adductus, whereas E for equins is an inward turning of foot. So we have seen in the previous image, the baby is having the foot, it is in an inward position, so towards the midline. So in that cases, the baby will be having the abnormalities related to the foot. So adduction is nothing but towards the midline. Abduction means away from the midline. So adductus is toward, that is the baby's foot is towards the baby's body or extremities. So see, in our left side it is a normal foot, but whereas when a baby is having club foot, the baby's foot is inverted. So sometimes it can be inverted or sometimes it can be in a outward, that is extension, and sometimes it can be plantar flexion or dorsiflexion. So next is types. So first type is positional club foot. So when we consider about the positional club foot, the deformed or malposition of fetus. So you can see that the baby is being placed in the uterus, that is the baby is going to be in the womb in a particular position. So when the baby is in a breech position or baby does not have any a fluid to move on. So when the mother is having maternal oligohydramnios, so maternal oligohydramnios means less amniotic fluid. So in that cases the baby cannot move freely. So what happens is when the baby is in a breech position for a prolonged period of time, that causes the positional club foot due to the position of baby. Next is congenital club foot. So from the word congenital means the baby acquires this club foot from the birth itself. So it may be associated with the other disease conditions like myelodysplasia, neuromuscular abnormalities. Next is syndromic, otherwise known as teratological. So teratological means nothing but during the pregnancy period, if a mother is consuming any kind of teratological drugs, or the mother is being exposed to any radiations, or mother is consuming or applying any medications which contains retinoids or thalidomide. So in that cases, the baby who is born for the pregnant mother who is consuming thalidomide will have a prevalence of this congenital talipus equinovarus, otherwise known as club foot. So other types are talipus varus. So we have seen in the meaning itself, no, talipus means ankle. So varus, valgus or calcaneus, it means the position of the foot. So talipus here means foot. So in varus means inversion. So when a baby is having inversion or bending inward of foot, it is known as talipus varus. And talipus valgus means the eversion or bending outward of foot. So from the image you can see it, how the talipus varus is, that is it is turned inward, and talipus valgus means it is turned outward. So next condition is talipus equinus and talipus calcaneus. So talipus equinus means plantar flexion and toe is lower than heel. So whereas talipus calcaneus means dorsiflexion, toe is higher than heel. So you can see in the image, so you can see that the baby is having the dorsiflexion, the heel is down and the toe is in the upward position. So these are the several types of congenital talipus equinovarus, otherwise known as club foot. So next is, we can see it, the footprint of the babies who is having the valgus and varus. So we can see the impression, how the foot impression is, and you can distinguish between how the normal foot is and how the baby with valgus foot and varus foot. So next is causes. So first cause is genetics. Yes, of course, when a baby is born, there is a chance if their ancestors are had condition of this club foot, there is a chance of acquiring this club foot in their offspring or in the next generations. Next is environment. Environment in the sense when a mother during her pregnancy period, if she had consumed any drugs or any smoking, so that may cause any congenital abnormalities related to skeletal system, and that too club foot. Next is family history, environment, and not enough amniotic fluid during pregnancy. During the pregnancy period, there should be abundant amount of fluid so that the baby can have the movement, so it will be protected. That amniotic fluid will protect the baby. So in certain cases, the mother will have a reduced amount of amniotic fluid so that the baby cannot move. So baby will be in a particular position for a prolonged period of time. So if the baby is in an abnormal position, that is going to cause the abnormality in the skeletal system. So next is part of other condition. So congenital talipus equinovarus is not only a single dimensional. So only it doesn't occur due to environmental issues or only the genetics issue, but also it is related to other abnormalities. If a baby is having abnormalities related to skeletal system or nervous system, there is a chance of developing clubfoot in the baby. So you can see the baby with spina bifida or meningocele or myelomeningocele, it is directly or indirectly going to cause the clubfoot also in that baby. So it is known as vectoral association. So vectoral association or vectoral abnormalities means V for vertebrae. If a baby is having abnormalities related to vertebra, esophagus, cardiac, trachea, renal, anorectal and limb abnormalities. So if a baby is having these all abnormalities, that's why it is termed in a mnemonic vectoral. So if a baby is having vectoral abnormalities, there is a chance of developing other associated abnormalities related to skeletal system also, that is limb abnormalities, and that too congenital talipus equinovarus, or otherwise known as clubfoot. So next is clinical presentation. So we can see in clinical presentation, there will be a deep crease on the inside mid aspect of foot. So higher arch than normal. So other problems we can notice is a smaller calf muscle in the affected leg. So which leg is being affected? So this congenital talipus equinovarus can be either unilateral or bilateral. That means either it can affect a single leg or both the legs. So which leg is being affected, that calf muscles will be in a very smaller. Next is shorter foot. So which leg is being affected, that will be shorter than that of the normal foot. Next is ankle stiffness. Next is lack of full range of motion in the foot. So when a baby is having congenital talipus equinovarus, so baby will not have a proper movement of their range of motion. So they cannot do proper pronation or extension, flexion, abduction, adduction. They may have some deformities related to it. So that will be lacking in the children who is having clubfoot. So next is diagnostic evaluation. So how we can diagnose the congenital talipus equinovarus? So one is team members. So team members in the sense, here when a baby is born, when we are considering the baby, when doing the inspection or assessment, we come to know the baby is having the abnormalities related to skeletal system. The team of members like pediatrician, orthopedician, clinical nurse and group of physicians, they all will turn together, they will combine together, they will have the diagnosis of this condition for the early diagnosis and prompt treatment. Next is ultrasound during pregnancy. So during the pregnancy period itself, we can identify if a baby is having any abnormalities related to skeletal system or not. Or sometimes what happens is, due to the baby's position, you cannot predict it 100%. So but most of the 75% to 90% we can identify during her ultrasound, that too in the pregnancy period itself. Next is physical examination. So when a baby is born, we will do the physical examination and we will identify how extent this problem is being affecting the baby. So whether only congenital abnormalities is there or any other associated abnormalities that is related to vectoral is there or not, like that we will see it. Next is X-ray and MRI. Next is electromyogram testing. Here the electromyogram testing is done to identify the baby's nervous and muscle function. So we will see that whether the nerve is being involved or not, whether there is the abnormalities related to muscle is there or not. Next is DNA testing. So we have seen in causes about the genetics. So when we are doing the DNA testing, we can identify whether it is caused due to any genetical abnormalities. Next is serum creatinine kinase. So in this case, in a congenital abnormalities related to clubfoot, they will be having increased serum creatinine kinase level. So next is management. So the main goal of this management is to achieve the normal functional level, to have a functional and pain-free feet. So you can consider a little baby is having the abnormalities related to skeletal system. So such in that cases, the baby will have pain, the baby will have a problem related to mobilizations or ambulation. So in that case, we are providing this management in order to recover or restore their function to the mere normal. Next is to wear the normal shoe. Next is to avoid permanent disability. If we are not doing the proper early diagnosis and treatment, that may lead to permanent disability. So only as soon as the baby is born, we have to consider the baby's health condition and we have to go for the early diagnosis and treatment of the condition. So next is non-surgical treatment. So mostly the babies, if they having any abnormalities related to skeletal system, we will not perform the surgical management. So initially we will go with non-surgical management only. So if the treatment is started during the neonatal period, the correction usually may be accomplished by manipulation and bandaging or by application of a cast. So manipulation in the sense, we are going to bring the deformed abnormalities to mere normal. It is not that you have to apply a full pressure over that foot. You have to apply a mere normal manipulation. Then we have to do either we can do the bandaging or we can apply the cast application, that is plaster of Paris application. So first method is Ponseti method. So Ponseti method is nothing but same. Manipulation is done. The orthopedician along with the pediatric nurses, what they will do is they will make the baby to have a normal position of the feet. So when the normal position of the feet is being acquired, after that we will apply the cast application. So here what happens, it is not that we have to do the manipulation, we have to apply a full force on the baby. We have to see how extent the foot can be moved. Based on that, without applying much more pressure, we have to manipulate it. Next, we have to provide a emotional support to the caregivers or the family members. So when you consider about a mother, you can see a pain on her eyes that her baby is suffering a lot. So in that cases, we have to provide emotional support to the mother, and we have to teach them what is the treatment modalities and what is the prognosis of the diseases. Next, after the correction with the cast, so first we are going to do manipulation, then we are going to do cast application, then we are going to apply a splint, that is known as Dennis Brownie splint. So this means that if the baby is having two shoes, if it is wearing in a wrong way, that is left shoe is being worn by the right leg and right shoe is worn by the left leg, how it will be, and in the same way this Dennis Brownie splint also will be. Okay, so after the manipulation and cast application, we will educate the parents or the caregivers to apply this Dennis Brownie splint. So this has to be worn for a certain period of time in order to make the proper alignment of the foot. Next is this Dennis Brownie splint still may be worn at night. So we used to say no, so if you are wearing any braces or splint at night time, you have to remove it. But in this cases, you need not remove this splint at the night time. Even at the night time, you can wear it, so that you have to wear until 3 months or 6 months as per the physician's order. So in order to have the proper alignment of the feet. So they will tell you certain days or certain months to wear. So if you are wearing for a prolonged period of time, sometimes what happens, it may lead to a overcorrection. So for that overcorrection, again we have to do the corrective methods. So we have to be careful and we have to watch the feet day by day, every day. Next is we have to provide a passive exercises of the foot. So passive exercises means it is the parents or the caregivers will give a passive exercise. They will make the exercise for the fingers in order to prevent the contracture. So this is the Dennis Brownie splint. You can see that after the cast application, you have to wear the this Dennis Brownie splint. So here there will be a rod between the two shoes. So here what happens is they will make, when normal feet is there, again club foot is there. So they will make the manipulation, then they will apply the cast, and after that they will ask the caregivers to wear this Dennis Brownie splint for the babies. So next is other braces and casts. So first we have seen the Ponseti method. So this is the French method. So this is means by stretching and tapping. So this approach is also called the functional method or the physiotherapy method. So here what happens is, here again they will do the manipulation. They will not apply the cast. Instead of that, they will apply the bandaging. So from the management we have seen, no, they will do either manipulation, bandaging or cast application. Ponseti method means manipulation and cast application. So French method means we are going to do the manipulation and bandaging. So once the shape is being corrected, continue to perform daily exercises and use the night splint until the baby is walking age is being reached. So we are going to do this French method, then we are going to apply this Dennis Brownie splint till the baby have age of walking. So this is the stretching and tapping, that is French method. Here we are not going to apply any cast application. Instead we are going to give a splint and bandaging. So this method requires a much greater time. So when you consider when you compare it with the Ponseti method, French method takes much more time to have the healing, but and at the same time, sometimes what happens, the caregivers or the physicians will have the both combination of Ponseti method and French method. You can see after the application of this tapping and everything, what happens, they will we can see here. So this is the manipulation. They are going to manipulate it. After that, they are going to apply this splint, and then there will be a bandaging. So you can see in both the legs there is a bandaging. So after correction, what happens? See, it will take some time to reach to the a mere normal method. Then the baby will achieve a normal alignment of their feet. So this is the French method. So these are the two main methods we use in the Congenital Talipus Equinovarus, and the main splint is Dennis-Browne splint. So next, even after doing this non-surgical management, sometimes we have to undergo the surgical treatment also. So when a baby reaches more than 10 years, we will go for lengthening the Achilles tendon. So we have seen in the signs and symptoms now, there will be a smaller calf muscles. So in order to relieve those smaller calf muscles, we are going to do the surgical management. That surgery is lengthening the Achilles tendon. So next is surgical treatment. Next is capsulotomy. Capsulotomy of major joint to lengthen the muscles and reposition the joint space. So we are going to lengthen the muscles wherever the muscles is being very short, like calf muscles or Achilles tendon. We are going to lengthen that muscle, and we are going to reposition the joint spaces so that they will have the normal positioning of the feet. So next comes the nursing management. So we have to do the neurovascular check at least every 2 hours. Observe for any swelling around cast edges. So when a cast is being applied, when a plaster of Paris is being applied, we have to see the edges, how the fingers is, whether it is in a swelling like that. Next is elevate the ankle and foot on pillows. So why we have to elevate the ankle and foot is in order to reduce the swelling. Next is pain management. If a baby is after doing the manipulation and cast application, there will be a pain because we are going to have the alignment of the bones. So there will be a pain. We have to administer analgesics. Next is stretching exercise with the baby. The mother or the caregiver has to provide the passive exercises. Next is putting child in special shoes and braces. So what is the special shoes we apply for the baby? That is Dennis-Browne splint. Next is make sure the child wears the shoes and braces as long as they need it. So it is not that for 1 day or 2 days we will wear this Dennis-Browne splint and then we will not wear it. So till the doctor or physician prescribes, we have to wear those Dennis-Browne splint till the normal alignment of the feet is being acquired. So that's all about the nursing management, and this is about the Congenital Talipus Equinovarus. So we will have a short warm-up session, like what is meant by Congenital Talipus Equinovarus. Congenital means it is acquired from the congenital period. So it is a deformity related to the ankle. That is why it is known as Congenital Talipus Equinovarus. Then we have seen the types. We have positional Congenital Talipus Equinovarus. We have a Talipus varus, Talipus valgus, Talipus calcaneus, and based on the position of the feet, this types is being classified. Next, we have seen what are the causes, what are the diagnostic evaluation, and we have seen the management. So initially we will go with the non-surgical management, then we will go for the surgical management, then comes your main part, that is nursing management. So as the pediatric nurses, it is very evident, and we have to provide not only for management for the babies, but also we are going to manage the full families and communities. So you can imagine when a baby is born, if a baby is having any congenital abnormalities, as a role of a pediatric nurses, it is our duty to provide emotional support to the family members and caregivers and explain them about how the treatment is going to be, how the prognosis is going to be, how the baby will have a normal milestone in the future terms. So that's all about the topic. Thank you for watching.